You wake up, open your eyes, and before you even sit up, you already know. Your tongue feels heavy, your mouth feels sticky. You try to swallow, and there is almost nothing there. So you reach for the glass on the nightstand, take a sip, and tell yourself what a lot of people have been told for years. It is probably just age. Nothing serious, just one of those little things. But let me say this as clearly as I can. If you are waking up with a dry mouth again and again, especially after 60, your body may be sending you a message that is far more important than most people realize. I'm Dr. William Lee. I've spent years in internal medicine, and one of the things that troubles me most is how often a small symptom gets brushed aside until it becomes the clue people wish they had paid attention to sooner. Dry mouth is one of those clues. It is easy to ignore because it feels minor, but many times it is not minor at all. It is an early sign, a signal, a quiet warning that something in the background has changed. And for a lot of people, the real cause falls into one of just a few buckets. Something you take every day is drying your system out. Something is happening while you sleep that is robbing your mouth of moisture night after night. Or a condition that has not been fully recognized yet is beginning to show itself in the most ordinary way possible. That is why I want you to stay with me, because by the end of this, you are going to know 3 things that can genuinely help you. First, you will understand what saliva is doing for you every night while you sleep, and why losing it matters much more than most people think. Second, you will know how to read the pattern of your dry mouth so it points you toward the likeliest cause. And third, I'm going to give you a simple morning check and a conversation strategy you can use with your doctor or pharmacist so this stops getting waved away. And there is one more thing. There is a version of dry mouth that is mostly bothersome. And then there is a version that travels with sleep apnea, medication overload, blood sugar trouble, oral infections, weight loss, or the slow breakdown of the teeth and gums. Most people do not know which version they have. After this, you will. Now, before I explain the causes, I want to start with something more basic, because once you understand this one point, the whole subject makes sense. A dry mouth is not just about comfort, it is about function. Saliva is one of the most underrated fluids in the human body. Most people never think about it unless it disappears. But all through the day and all through the night, saliva is doing job after job after job for you without asking for attention. It helps break down food. It helps you taste your food. It helps you form a swallow. It protects the surfaces of your mouth. It helps keep the bacterial balance under control. It helps defend your teeth. And when it falls off, all of those protections weaken together. That is why I want to walk you through 4 quiet jobs of saliva, because each one explains a different kind of risk. And once you see those 4 jobs clearly, your own symptoms stop feeling random. The first job is protection while you sleep. Most people have no idea this happens, but during sleep, tiny amounts of secretions from the mouth and throat can slip backward. In healthy people, that may happen without causing any trouble at all. In fact, one classic study found that this kind of aspiration during deep sleep happened in a surprising number of normal adults. Usually, that is not a crisis, because the body clears what it needs to clear, and the mouth itself is not heavily loaded with trouble. But when the mouth is chronically dry, the whole environment changes. Without enough saliva, the mouth loses part of its natural cleansing system. Bacteria are less effectively washed away. Tissues become more irritated. The balance shifts. So now the little bit moving backward overnight may not be the same as it was before. And in older adults, especially those who are already more vulnerable because of frailty, poor oral health, dentures, swallowing problems, or lung disease, that matters. This is one of the reasons I do not like it when morning dry mouth gets shrugged off. Sometimes it is not just a thirsty mouth. Sometimes it is the surface sign of a nighttime problem that is unfolding quietly over months or even years. Let me put a person in the picture because I think examples make this easier to feel. I'll call her Margaret. She was 71, a retired elementary school teacher, organized, thoughtful, never dramatic, the kind of person who didn't want to complain unless something was truly wrong. For nearly a year, she kept water by her bed because her mouth felt so dry in the mornings that she needed a sip before she could even speak properly. She thought it was annoying but not important. Her family thought it was one of those ordinary age things. A doctor had once told her to drink more water, so that is what she did. Then she had 2 chest infections in less than 2 winters. Nothing catastrophic. Antibiotics, some fatigue, slow recovery, and then life kept moving. But when I look back at the pattern, what stood out was not just the infections. It was the dry mouth that had been there long before them, every morning, quietly telling the story before anybody listened. Now, I need to be careful here. I am not telling you that waking with a dry mouth means pneumonia is around the corner. That would be too simplistic, and it would not be fair. What I am telling you is that a persistently dry mouth can be part of the same chain of problems that raises risk, especially if oral hygiene has slipped, dentures are not being cleaned properly, snoring is severe, or saliva has been reduced by medications for a long time. So that is job number 1. Saliva helps maintain a safer environment in the mouth while you sleep. When it disappears, the cost is not always immediate, but it is real. Now the second job. Saliva helps you get nourished. People hear that and think, yes, it helps you swallow. But it is more than that. Digestion does not begin in the stomach. It begins the moment food enters the mouth. Saliva starts the breakdown process. It softens food, helps bind it together, and lets you move it comfortably. It also carries flavor, and that matters more than many people realize. Because when your mouth is dry enough, eating changes. Toast scrapes. Crackers crumble into dust. Meat becomes a chore. Raw vegetables can feel like work. Dry rice, bread, cereal, nuts, even certain fruits can suddenly become the kind of foods you start avoiding without fully noticing you are doing it. Then something else happens. Meals get smaller. Variety gets narrower. Food becomes less enjoyable. Appetite drops. The viewer at home may still say, "I'm eating," and technically that is true, but they are not eating the same way. This is one of the most deceptive parts of dry mouth. It does not only reduce comfort, it can slowly reshape a person's diet. And when that happens over months, you begin to see the consequences in the most ordinary places. Lower energy, unintended weight loss, a tendency to favor softer, more processed foods because they are easier to manage, less protein, less fiber, less fluid, less pleasure in eating. Research on xerostomia in older adults supports this pattern. People with dry mouth often reduce intake of exactly the kinds of foods that help keep them strong. That was Margaret's second clue. Her daughter noticed it before anyone else did. She said, "Mom, your clothes are hanging on you." Margaret insisted she was eating normally, but when we talked through it carefully, she wasn't eating normally at all. She had unconsciously started designing her whole diet around what slid down easily. Yogurt, mashed things, soft bread, soup, pudding, tea. Not because she chose that plan, but because her mouth had been steering her there. And this is where so many people miss what is happening. They blame age, or grief, or low mood, or say the appetite has just changed. But a dry mouth can be one of the hidden reasons the body stops getting what it needs. So if you have had a dry mouth, and you have also been eating less, losing weight, skipping crunchy or fibrous foods, or finding that everything tastes flatter than it used to, please do not dismiss that combination. It deserves attention. The third job of saliva is balance. Your mouth is home to a huge microbial community. That is normal. That is not automatically dangerous. But like many things in the body, it depends on balance. Saliva helps maintain that balance. It rinses, it buffers, it protects tissues. It helps keep the environment from tipping too far in the wrong direction. When saliva falls, the mouth often becomes more acidic, more irritated, and more hospitable to trouble. Plaque builds more easily. Gums become more inflamed. The tongue changes. Breath changes. Yeast can sometimes gain ground. Small cracks appear at the corners of the lips. Dentures become harder to tolerate. And the person living through it may still think the problem is simply, "I need more water." But a dry mouth is not just a water problem. That distinction matters. Water can briefly relieve the feeling. It can help you swallow for a moment. It can wash over the tongue. But saliva is not just water. Saliva is a functional coating. It contains the things that protect, lubricate, buffer, and support. That is why some people can drink all day long and still wake up feeling as if their mouth has been left out in the sun all night. And once gums are inflamed and bleeding more easily, the mouth is no longer an isolated place. The mouth is full of blood vessels. That is why oral health and the rest of the body are not separate stories. Even the American Heart Association explains that everyday activities like brushing and flossing can briefly allow mouth bacteria into the bloodstream, and in vulnerable people, poor dental health matters. That does not mean everyone with dry mouth is heading for heart trouble. It means this area of the body deserves much more respect than it usually gets. There is also a well-known two-way relationship between diabetes and oral health. High blood sugar can worsen dry mouth and oral problems, while gum disease can make diabetes harder to manage. That is one reason I want people to stop thinking of a dry mouth as a tiny, isolated annoyance. It often travels with bigger systems. Now for the fourth job. Saliva protects your teeth and oral tissues. This is the part dentists understand immediately. Saliva helps neutralize acids and supports remineralization of the teeth. In plain English, it helps prevent your mouth from becoming an ideal place for rapid decay. When saliva stays low long enough, cavities can appear faster, gums can suffer, dentures can become uncomfortable, and the inside of the mouth can become more fragile. That is why some people do everything right from their own point of view and still start having dental trouble out of proportion to what they expect. They brush, they try, they keep water nearby. But the hidden issue is that the mouth has lost one of its main defense systems. And once again, this matters even if you wear dentures. A lot of people think, well, if I do not have all my natural teeth anymore, this is less relevant to me. Not true. Dentures depend on the condition of the tissues underneath them. A dry mouth can make them fit worse, rub more, trap debris more easily, and increase discomfort and infection risk. So this is not only a tooth story, it is a whole mouth story. Now, once you understand those four jobs, the question becomes the one that actually changes lives. Why is your saliva low in the first place? For many viewers, the answer is not exotic. It is sitting in a pill box. Medications are one of the biggest causes of persistent dry mouth. And I want to slow down on this because it catches people off guard every time. The issue is not only one medication. Sometimes it is the combination. One medicine may dry the mouth a little, another may do the same, a third may do it mildly, but together they create a much bigger effect than any one of them seem to cause on its own. This is especially true when the medication list includes drugs with anticholinergic effects. That is a technical phrase, but it is a useful one. These are medications that can reduce secretions, including saliva. The list can include common medicines people take for allergies, bladder urgency, depression, sleep, anxiety, dizziness, or certain stomach and cold symptoms. Some blood pressure medications can contribute as well. So can decongestants. So can over-the-counter products people forget to mention because they do not think of them as part of the medication story. That is why a person can go years saying, I have had dry mouth for a long time and nobody knows why, when the reason is actually hiding in plain sight. And here is something else worth knowing. Once a person is taking several medications at the same time, side effects become harder to sort out. Polypharmacy is often defined as the regular use of 5 or more medications. That does not mean 5 medications are automatically wrong. Many people truly need them. But once the list gets long enough, it becomes much easier for nobody to see the total picture. Margaret, as it turned out, was taking multiple medications that all leaned in the same direction. None of them looked dramatic when considered separately. Put them together, and her mouth had been paying the price for months. This is why one of the most useful questions you can ask is not, is this one pill causing it? But rather, could my medication combination be contributing to my dry mouth? That is a better question, a more realistic question. And please hear me on this part. Never stop a prescription medication on your own because of something you hear in a video. That is not what I am advising. The right move is review, not guesswork. The goal is to bring the full list to a doctor or pharmacist and have someone assess whether the burden of dryness can be reduced safely. But medications are only one bucket. The second big bucket is what happens overnight. If your dry mouth is worst when you first wake up and eases later in a day, that pattern matters. It often points toward mouth breathing. And mouth breathing at night may happen because of nasal congestion, allergies, snoring, poor denture fit, sleep position, or sleep apnea. This is where the body can be surprisingly revealing. If you snore heavily, wake tired, fall asleep easily during the day, have morning headaches, or your partner notices pauses in breathing, then morning dry mouth may be one piece of a larger sleep story. Studies do show that waking dry mouth is more common in people with sleep apnea or sleep disordered breathing than in controls, though factors like body weight also play a role. Still, in practical terms, that pattern is enough to take seriously, because what many people call "I just sleep with my mouth open" sometimes turns out to be "my airway is struggling all night." That is a very different sentence. A third bucket is blood sugar. Dry mouth can show up when diabetes is not well controlled, and it may arrive alongside increased thirst, more frequent urination, fatigue, blurred vision, or recurrent mouth issues like thrush. High blood sugar changes the whole environment. It affects hydration, tissues, infection risk, and oral comfort. So if dry mouth has shown up together with nighttime bathroom trips, stronger thirst than usual, or a general sense that something is off, that is worth checking rather than guessing at. Then there is Sjogren's disease, which is one of the most important conditions to remember if the dry mouth comes with dry, gritty, irritated eyes. NIDCR notes that Sjogren's often appears after age 50 and is much more common in women. The combination of dry mouth and dry eyes is one of its classic patterns. Some people also notice fatigue, joint discomfort, dry cough, or a general sense of dryness affecting more than one part of the body. It is not rare enough to ignore, and it is not the kind of thing people should have to stumble into late. There are other causes too: smoking, alcohol, certain cancer treatments, nerve injury, dehydration. But if I had to tell you where to look first in the average older adult with persistent morning dry mouth, I would say medication list, breathing during sleep, blood sugar pattern, and the dry eyes question. Now let me clear up 3 myths that keep people stuck. The first myth is that dry mouth is simply normal aging. No, not in the way people usually mean it. Aging may make a person more likely to have the conditions and medications that lead to dry mouth, but persistent dry mouth itself is not something official medical sources describe as a normal part of aging. That is an important distinction. If you have it all the time, the right question is not, "How do I accept this?" The right question is, "Why is this happening?" The second myth is that if you just drink enough water, the problem should go away. Hydration matters, absolutely, but many people with dry mouth are not dealing with a simple lack of water. They are dealing with reduced saliva production or altered saliva quality. That is why they can drink and still feel as though the relief does not last. The problem is not just fluid intake. The problem is the system that is supposed to make and maintain the mouth's protective moisture. The third myth is that dry mouth is mostly an annoyance. I wish that were true. Sometimes it is mostly an annoyance, but often it becomes a gateway symptom, a symptom that points toward medication burden, sleep disorder breathing, diabetes, oral infection, malnutrition, or dental decline. That is exactly why I am making this video, because a lot of people are living with something that feels small while it is quietly changing bigger parts of their health. Now let me show you how I want you to read your own dry mouth, because this may be the most useful part of the entire video. If it is worst first thing in the morning and clearly improves later, think nighttime breathing first. Ask yourself whether you snore, whether your nose stays blocked, whether you wake with headaches, whether you feel unrefreshed, or whether someone has told you that your breathing sounds irregular while you sleep. If it stays with you all day and your medication list is long, think medication burden, especially if the dryness began or worsened after a prescription change, a new allergy medicine, a sleep aid, or a bladder medication. If it comes with thirst, urinating more often, fatigue, or recurrent mouth infections, think blood sugar. If it comes with dry, gritty eyes, think Sjogren's until proven otherwise. If it comes with white patches that do not wipe away easily, soreness under dentures, cracks at the corners of the mouth, or a burning tongue, think that the mouth itself may already be developing secondary problems and needs attention promptly. That is how you stop treating dry mouth as a random inconvenience and start treating it as information. And now I want to give you the 2-minute morning check I promised, because it is simple, free, and surprisingly useful. Tomorrow morning, before you drink anything, before you brush your teeth, before you even fully begin the day, pause for a moment and pay attention. Can you swallow comfortably the moment you wake up, or do you need liquid first? Does your mouth feel merely dry, or does it feel sticky and tacky, as though the tissues are almost clinging? Does your saliva feel thin or thick and stringy? Is your tongue smooth, rough, burning, or heavily coated? Do your lips feel cracked? Is there a strange taste, a strong morning breath beyond the usual, or soreness under a denture? And most importantly, is this happening once in a while or nearly every morning? Do that for 3 to 5 days. Write it down, not in a dramatic way, just a few words. Very dry, needed water before swallowing, better by lunch, or dry all day, worse after allergy pill, or dry mouth plus dry eyes. That tiny record can make the next conversation with a doctor far more productive, because now you are bringing a pattern, not just a vague complaint. And that leads to the next practical step. Do a medication audit. Write down every prescription, every over-the-counter pill, every sleep aid, every allergy tablet, every supplement, every mouth rinse you use regularly, every as-needed product you reach for more often than you realize. Then take that list to your doctor or pharmacist and ask for a dry mouth review. If you want to sound especially focused, you can say, "Could you review whether my medication list is contributing to dry mouth, especially anything with anticholinergic effects?" That is a very reasonable question. If you are taking 5 or more medications, it is an especially important one. Again, do not stop anything on your own. But do not assume nobody can improve the situation either. Sometimes the fix is switching the timing. Sometimes it is lowering a dose. Sometimes it is swapping one drug for another in the same category that is easier on the mouth. Sometimes it is realizing an older medication is no longer needed. And sometimes the answer is that the medicine is necessary and must stay. But now at least you know why the mouth is dry and can protect it properly. That brings us to relief. What actually helps? The first thing is simple, but it matters. Protect the mouth overnight. If the dryness is worst in bed, that is when you need support most. A room humidifier can help. Nasal breathing matters, so if congestion is part of the picture, deal with the congestion. If you snore hard or suspect sleep apnea, do not settle for guessing. Ask about evaluation. The second thing is to stop making the mouth drier by accident. Alcohol-containing mouthwashes often make the problem worse. So can tobacco. So can frequent caffeine for some people. So can sugary candies people suck on for temporary relief, because now you have dryness and a cavity problem working together. The third thing is to stimulate saliva if your glands can still be nudged. Sugar-free gum, sugar-free lozenges, and xylitol-containing products can help some people. The act of chewing itself often wakes the glands up. For many viewers, that is a far better strategy than constantly sipping sweet drinks or relying on breath mints. The fourth thing is lubrication. Saliva substitutes, sprays, gels, and specialized dry mouth rinses can be surprisingly helpful, especially before meals and before bed. They do not fix the underlying cause, but they can make the mouth safer and more comfortable while you sort that cause out. The fifth thing is dental protection. If you have persistent dry mouth, routine dental care becomes more important, not less. Fluoride support may matter. Your dentist may recommend a specific rinse, gel, toothpaste, or tray depending on how severe the dryness is and how your teeth are holding up. And if you wear dentures, hygiene and fit matter even more when saliva is reduced. The sixth thing is food strategy. Do not let dry mouth slowly force you into a weaker diet. If meats are hard to chew, moisten them rather than abandoning protein. If dry grains are difficult, combine them with sauces or soups. If crunchy vegetables are too harsh, soften them. Keep trying to protect the quality of what you eat, not just the ease of swallowing it. Margaret eventually did what I wish more people would do sooner. She stopped treating the symptom as a nuisance and started treating it as a clue. Her daughter came to an appointment with her, and together they asked better questions. Not, can you recommend another mouthwash? But, why is this happening and what else is connected to it? That changed everything. Her medication list was reviewed properly. A couple of medicines were identified as part of the problem. One was adjusted, another was replaced. Her nighttime snoring history was taken more seriously than it had been before. Her oral care routine was changed. A humidifier was added. She started using a dry mouth gel at night and a saliva-stimulating strategy during the day. None of it was glamorous. None of it was some miracle trick from a headline. But within weeks, the mornings were easier. Within a couple of months, eating felt less effortful. She started enjoying meals again. Her energy improved. And maybe the most important shift of all was this. She stopped feeling as though her body was betraying her for no reason. She finally understood the pattern. Once people understand the pattern, they make better decisions. They ask better questions. They get taken more seriously. That alone can change the course of what happens next. Now, I want to leave you with the exact action plan I would want one of my own patients to follow after hearing this. Tomorrow morning, notice the pattern before you drink. Write it down for a few days. If the dryness is persistent, review your medications with a doctor or pharmacist. Bring the whole list, not just the prescriptions you remember. If the dryness is strongest in the morning, ask whether mouth breathing, snoring, or sleep apnea could be part of the story. If it comes with thirst, frequent urination, fatigue, or repeated infections, get your blood sugar checked. If it comes with dry, gritty eyes, bring up Sjogren's directly. Use dry mouth-friendly support, sugar-free gum or lozenges, saliva substitutes, alcohol-free products, a humidifier at night, and good dental protection. And if you are also losing weight, having trouble eating, developing rapid dental problems, struggling with dentures, or getting repeated mouth infections, do not wait around hoping it settles by itself. There are also a few moments when you should move faster. If you have severe dry mouth with trouble swallowing, significant weakness, chest pain, confusion, or breathing difficulty, that is not a watch and wait situation. And if you notice persistent white patches, painful sores, or rapidly worsening mouth pain, get evaluated promptly. Because at the end of the day, this is what I most want you to remember. Your body rarely wastes effort on a signal. If it is telling you the same thing every morning, over and over, that signal deserves respect. Dry mouth may feel small, but small symptoms are often where bigger stories begin. And if you learn to listen early, sometimes you can change the whole story before it gets much harder to change. That is really the heart of this channel and the heart of the work I care about most. Helping people stay strong, sharp, and independent later in life by noticing the things that are easy to overlook until they are not easy anymore. So if this helped you, do me a favor, subscribe, give the video a like, and leave a comment telling me one thing. Is your dry mouth mainly a morning problem, or is it with you all day? I read those comments, and they help shape what I cover next. Take good care of yourself. Pay attention to the quiet signals. They are often the most honest ones. And I'll see you in the next video.